Without any further delay, it does give me a great honor and privilege to have Dr. Mohammed Alabdulaali with us today. Dr. Mohammed Alabdulaali is prominent administrator, physician, scientist in Saudi Arabia. He's the Assistant Minister of Ministry of Health in Saudi Arabia. He's a spokesperson of the Ministry of Health. He has been a front face in fighting COVID pandemic. By scientific background, he's a hematopathologist. So we are very lucky to have him today. Dr. Alabdulaali, the floor is yours.
Thank you so much, Dr. Firas, and thanks for all who are attending and participating and organizing this annual Saudi Hematology Congress. And thanks for the Saudi Society for Blood Disorders, for organizing such an annual congress with targeting a very important group of disorders, whether malignant hematological disorders or benign hematological disorders in the region, and bringing a group of experts and seniors and leaders in the field of hematology to share their ideas, bring updates. And as far as I know, that there are more than 30 renowned speakers from around the globe participating in this activity, and among them experts from the national level here from the kingdom. I'm proud to be participating in this activity, proud to be in communication and in networking with my dear seniors and my dear colleagues and peers and scientists and those who are in the field of hematology serving our community. Thank you very much, and inshallah it's going to be a good experience. I can see that the organization is focusing on lots of virtuals. The sense of entering the Congress, the sense of entering the registration zone, the sense of looking at poster presentations, the sense of looking at exhibitions. It's really a good experience, despite it's not physical, but virtually perfect in its organization. So congratulations for that. And I'm sure that the content is also of a high level that's going to be fruitful for all. I understand that all these things will be usually physical, if not COVID-19 pandemic was in front of all of us since last year and during the beginning of this year. But alhamdulillah, the whole world is reaching to a very important step at this moment with the availability of vaccine and with the speed of rollout around the countries. And alhamdulillah, our country is listed among the best countries in handling COVID-19 pandemic, as well as in handling the vaccination and immunization stage of control of this pandemic, not on national level, but with the collaboration with other countries and other organizations to fight it around the whole world and to support all countries to reach to a good status in terms of immunity against this virus. The Ministry of Health is playing a very important role also in handling the hematological disorders in the country, whether benign or malignant. There are programs that are focusing at the moment on COVID-19. Guidelines were prepared from a group of scientists and group of experts who are working under the supervision and the support of our national program for the improvement of blood disorders, led by one of the speakers in this Congress, Dr. Hatoun Izzat. There are many other activities that this program is and this administration is doing in Ministry of Health. There are multiple activities, including the preparation of a concept of center of excellence to manage the benign hematological disorders in the kingdom, particularly sickle cell disease and thalassemia, as well as hemophilias. Guidelines, virtual healthcare will be introduced soon to the service of hematological disorders. The international educational activities as well as national educational activities for the workers and professionals in this field. Besides, there are many and multiple initiatives that are supported and supervised and sponsored by their excellencies, the minister and the vice minister, with extreme attention and excitement to see all the activities that are approved to be part of our our projects and initiatives and ambitious projects in the year 2021. There are also registries. Sickle cell registry among these registries started and kicked off several thousands of patients already registered in the registry, and we are aiming to reach 100% as soon as we can. There is a plan already for that, and there are collaborative work and agreements with international and local partners. Genetic counseling will be one of the most important areas to work hand in hand with the public health and preventive medicine to achieve and improve. The newborn screening also, there are going to be lots of activities in that, and soon, if not in Q2, then Q3 this year, it's going to be up and running, and many others. Many other activities will be there. We also gonna celebrate next year 20 years of the start with the royal decree of the genetic or premarital counseling and genetic screening, particularly for sickle cell disease and thalassemia, and later on some other conditions added. And this also a very important moment of time. I may recommend this Congress or the coming Congress to consider giving space for this very important national initiative to see after 2 decades where we can go in future. With that, I hope everybody will enjoy it. I hope the international guests will be here in Kingdom as soon as possible, inshallah, with the ease of all the restrictions, inshallah, will we go in recovery after this pandemic. Thank you very much. Thanks for the organizing committee. Thanks for all participants and speakers. Thanks, Dr. Firas Al-Freih, for the kind invitation and amazing organization. Thank you very much. Assalamu alaikum.
Thank you, Prof. Ali. We appreciate your participation. We'll move to next. Now it's my great pleasure to introduce Dr. Riyad Al-Faqih. Dr. Riyad is the head of the research department in King Faisal. He's an associate professor in hematology and bone marrow transplant. Dr. Riyad is the scientific chair of the malignant hematology session. Dr. Riyad.
Assalamu alaikum. I'd like to welcome everybody, and hopefully you have a fruitful meeting. Will not take long, just to get started. So today we will have 2 sessions about malignant hematology, and tomorrow we will have the same, inshallah. The first session today will be moderated by Dr. Firas. You all know Dr. Firas, the head of the Saudi Society of Blood Disorder and a consultant at King Faisal. So he will be moderating the first session. And the second session will be moderated by Dr. Syed Usman Ahmed, a hematology consultant at King Faisal Specialist Hospital. Each session is 3 talks and 15 minutes for questions and answer. Each talk is 25 minutes. And in between the sessions, we will have 15 minutes break. That's at 16:50. So from 16:50 to 17:05, we will have a break. And then the second session will resume. We do have a virtual exhibition. We encourage all of you to visit and visit the booth of our sponsors. We thank our sponsors to make this meeting happen in the middle of this pandemic. Without any further elaboration, I would like to leave the floor for Dr. Firas Lefreh to start the first session. Firas.
Thank you, Riyadh. So it's my great pleasure to introduce Dr. Wendy Stock. Dr. Wendy Stock is a renowned physician, scientist, educator in leukemia in general, and specifically in acute lymphoblastic leukemia. She's a professor at the University of Chicago. She has more than 200 peer-reviewed papers. Also, she's receiver of several awards as a researcher, as an educator, as a top doctor physician. Without a delay, so she will be talking today on the current trends and advances in the frontline management of acute lymphoblastic leukemia. Dr. Wendy, if you can unmute yourself. I would like to remind the audience, you can type the questions and we'll try to address them at the end of the session. Thank you.